Today on Substance Stories, I'm going to be sharing with you my tips on how to identify the underlying cause of our addictions. Move over Drake and I can't remember the other rapper's name. I'm going to start a new war, a rap war, so to speak. I'm just finishing Anna Lembke's wonderful book, Dopamine Nation. And it's a fantastic book. I recommend everyone read it. But I actually have a huge problem with something that Anna says in there. She says very clearly that she thinks that anyone, if they take a 4-week break from their addictive behavior, then they'll just feel better. That'll be it. And she thinks that if they don't, then it's not their addiction that's making them feel poorly, miserable, sad. And I think this is a profound misunderstanding about where addiction comes from and what addiction is. And so you can go back to, I think it was episode 1 where we talked about what addiction is. But my view is that addiction is a response to physical pain, emotional pain, bad life circumstances. It's a response. It is a coping mechanism to something, which I guess would bring me more in line with someone like Bruce Alexander, who also has written some wonderful books I'd recommend. I think that whilst it is a response to something bad, it makes that bad thing worse. So if I'm drinking because I feel depressed, my drinking is going to make me more depressed. It's going to help in the short term, and it's going to make something worse in the long term. So I'm going to disagree with Anna that I'll just feel magically better if I stop drinking for 4 weeks. In fact, there's a fair chance I feel worse. So people with trauma behaviors that are using their substance use or addictive behavior to escape their traumatic memories, to avoid those traumatic memories, they'll often get a flood of those memories back. So there's an old AA/NA phrase, which is the best thing about sobriety is getting your feelings back, and the worst thing about sobriety is getting your feelings back. And that's my view completely. So I'll disagree to Anna, and that's I look forward to her upcoming diss track on me. But I think that addiction is a response to something. And if we don't address what it is responding to, then there's a high chance of substituting our addictive behavior into another addictive behavior. So for instance, I might get sober from alcohol and then get into heroin or become a workaholic or a gymaholic. So to me, it's really important that we find out what our addiction is in response to. And I spend a lot of time with my patients trying to work that out. We've got to work it out collaboratively. And so today I'm going to try and talk through a few things to how we can identify what our addiction is a response to, because we need to get a plan on treating that as well. The first thing I'll say is I think it's really important to stay open to what our addiction is a response to changing over time. So I've had a lot of people that, it's very clear they have PTSD or another mental illness, and that's what's driving their addiction. But as they get further into their recovery and they are able to sit with their sober self more and more and do more explanation, we say, there was this other thing. And what our addiction is a response to can change. So we might go through some trauma-focused therapy and our trauma symptoms can get a lot better, but then we still have these cravings strength. Then we identify other things in our life that can be improved. So I think our addiction is always a response to something, but that something might change over time, especially the further we get into our recovery. So how do we work out what our addiction is a response to? Well, we can look backwards. So I always want to know, when was it that we lost control of our behavior? When it was that our drinking became daily, or we lost control of our substance use, and what was going on in our life, and what stresses and what were we experiencing? How was it helping us? What is our substance use or addictive behavior doing for us now that is helping us? What are the positives that we don't want to let go of? The second thing I like to talk to patients about is, when they did achieve sobriety, what was it that helped them achieve sobriety, and what was it that led to their relapse? So those are great ways of looking back in time about our addictive behavior, and that can be quite a difficult experience, but I think it's a very useful thing to look back on. One of the things that makes this so hard is our compulsive addictive behaviors can be so good at helping us avoid those difficult thoughts and feelings, that it can actually be really hard to look back and think about what caused our addiction. And the other thing that looking back and trying to analyze our previous behaviors, the other difficult part of that is that that's susceptible to sort of bias in our recall. We can say, it must have been that relationship that we were unhappy in, or it must have been that job we were unhappy in. And whatever narrative we put to that, to our memories and our story so far, is subject to bias. It might be true, it might not be. It might be a story that we have told that sort of matches the circumstances but misses the actual underlying truth. So what I also like to do with my patients is look forward. And I guess at the core of this is understanding that addiction is a chronic relapsing condition. It is, even though I would love for everyone I meet to be sober from now on after I meet them, I acknowledge that that's unlikely to happen. I think what my job as an addiction specialist is to help people make those relapses shorter and shorter and further apart and learn from them. So a lot of people like to say to me, oh, that's it, I'm never going to drink again, or I'm never going to use drugs again. And I say, I hope that is true. But realistically, it's not true. And what we need to do is make sure that we're not burying our head in the sand and trying to ignore these relapses. We want to learn from each relapse. And I think underlying this is this view about the stigma towards addiction. I think that if we view addiction as any other illness, like diabetes, then there's nothing wrong with us. There's nothing wrong with us having a relapse. It's part of the illness. The problem would be if we didn't learn from those relapses and we stopped trying to get sober. Now, I go back to Durkheim's sick role, which is not, it's the social role we take on when we are unwell. And in Durkheim's sick role, it says that, we have 4 key things when we're in the sick role. We're not responsible for being unwell. We don't have to go to work or study or do our normal duties, but we do have to try and get better, and we do have to listen to the advice of medical experts. And I think that's to me, that's the key thing there. It's absolutely not our fault when we have a relapse. It is part and parcel of this chronic condition we call addiction. But it is our responsibility to learn from that and to try and make those less and less and to try and seek help. So if we have this attitude towards our addiction, we say, I will have a relapse, but I'm going to learn from each one. Well, how do I learn from it? Well, I get my patients to draw up a little spreadsheet, and in it that's our cravings journal. So if I experience a craving or I have a relapse, I want to write down who I was with, where I was, when it was, what I was doing, and then keyly, what I did, how I felt after, and that's it. And it doesn't matter what I did. Could have been I used this breathing technique to ride out the urges, or it could have been I drank. It's really important, to have this shame-free way of looking at addiction. Doesn't matter how you responded for it, as long as you're learning from it. And the really useful thing is this: someone will come in, we'll do this prospectively, and then we'll come in and we can look at it together and we can say, oh, I noticed, this pattern that we haven't noticed, but every time it's this time of day, or you're here, or you're with this person, or you're doing this thing, it seems like, you get these cravings. So not every time, but it seems as a common factor. Then we can explore that and we can understand new things. So, I've had people that, I'm thinking of a patient in particular, he didn't realize, but he actually had this crippling social anxiety, but it had been masked by his substance use. And it was only till he got a bit of sobriety and he had to go on a out dinner with friends, and he realized how anxious he was. So he had a small relapse. We talked about it the next session, and we realized, oh my goodness, this huge social anxiety, and that's something we can target. That's something we can start treating. We got on an antidepressant to manage social anxiety. We started doing methods for social anxiety, sort of psychotherapeutic techniques. He could have just as easily sort of buried his head in the sand and said, I don't know why I relapsed. I did, but I'll just get clean again, and that's it. And he would have gained nothing from that. Instead, he's, managing a new thing he didn't know about. He's preventing future relapses, and he's happy. It has less social anxiety now. So it's really important that we don't bury our heads in the sand, but we have this sort of accepting and forgiving attitude towards addiction. And with that comes this ability to learn from it. So I'm a big fan of prospective looking at our addiction. And even if we don't have a relapse, even if I just feel these cravings and I resisted it, but we can still take that cravings journal into the next session. We can learn from it. We can talk about how we cope with these circumstances. So with respectfully disagreeing with Anna, who has a wonderful book, which I recommend, called Dopamine Nation, but I don't think that just sobriety will make you happy. In fact, I think the vast majority of people's sobriety can lead to an earlier on, we feel a lot less happy because we're faced with all these things we've been trying to escape. Obviously, over time, sobriety leads to happiness. I think there is no way to have a happy life without a sober life. But earlier on, it's hard. We learn from it. We find out a way to guide the things underneath it. The things that lead to our addiction, can be physical pain, emotional pain, PTSD, can be a poor sense of self, an emotional regulation disorder, can be insomnia. All of these things will be made worse by our addiction. But stopping our addiction alone won't help. It'll stop the bleeding. If I have an alcohol addiction, PTSD, my alcohol addiction is making it worse. If I stop drinking, I'll stop the bleeding. I'll stop making my PTSD worse, but I won't fix my PTSD. So it's really important to have an addiction specialist, have a psychologist, both of those things, part of the famous five, who you trust, who you can work with together. You find out what is underlying your addiction and make a great plan on how to address it. Thank you so much for listening. I hope you enjoyed this session. This has been Substance Stories. Do not forget to write in any questions you have that you'd like us to cover. I would love to hear your letters. Thank you so much. Catch you next time.